Welcome to TechZine.tv.
Welcome to a new episode of TechSign TV. We're at HPE Discover, and we're going to talk to Jake Marshak. He's Associate CTO at Inova Health System. And of course, Sander is also here.
That's true.
Yeah,
We keep saying that to each other.
it's very
Excited
to
You haven't
have this
left yet.
conversation.
That's a good sign.
Yeah, I haven't left yet, and another networking thing. So I'm game.
Yeah,
Yeah.
yeah, we're talking to Jake. Yeah, you won the network of a very large health organization. Maybe you can tell us a bit more about it for the people who are not familiar with the Inova Health System.
Sure, we're not a household name outside of our zip code. So yeah, we're the regional health system in Northern Virginia, so right outside Washington D.C. 5 hospitals, 2,000 licensed beds. We did about 2 million patient encounters last year. So definitely not the biggest name. There's lots of big names in healthcare, but
You're not a small hospital.
not a small hospital. Not definitely in a very important place on
I
the
think
planet.
based on the conversation we had before this video, to European standards, you're a giant hospital, probably.
Yeah, yeah. I realize healthcare around the globe is a different animal. Being a nonprofit health system in Northern Virginia, we really just see the impact we have on the community. All right. I mean, as much as there's struggles in the healthcare world today, across the globe, but especially in America, having our focus on the community and the patients that we serve and the care that we deliver every day, and taking what resources we do have left at the end of the day and reinvesting them into the community, whether it be our capital projects. We're building 2 hospitals right now.
Okay.
So that's unheard of. Health systems don't build 2 hospitals in the same region at the
No.
same time, but we see what's happening with our patient population and the need of the communities that we need to serve. And we decided to jump off that cliff and with both feet and have tremendous support from the organization to get those projects done on
Now,
time.
are these also very large hospitals, or are these smaller than the
Yeah.
venues you already have?
No, they're good size. I think total between the two projects, there's about 400 beds. So those are good size. Cancer center, um, just needing one of the facilities is a replacement for an existing hospital that just doesn't make sense to continue to invest in. So we're
Okay.
working to build a new facility for that community. Again, that includes a cancer center and all the things that go around the care environment. And then the other one is in Springfield, Virginia, which has never had a hospital. So we've had an emergency room there,
Okay.
and it's a gap. If you look at the map, you'd say, "Why didn't somebody put a hospital there?" And we decided it was time to up
So
the
I think
facilities.
we're ready now for some big numbers. When it comes to your network, how many how much stuff do you have in there in terms of
Yeah.
switching and APs and clients and all that stuff?
Sure. So we have the 5 main hospital campuses, a headquarters campus, and then about 140 what we call ambulatory locations. So those are care delivery sites
Yeah.
that could be everything from a standalone emergency room to a small medical office practice. For those 140 sites and 6 big campuses, we have on a good day 125,000 active nodes on the network. So that just gives you an idea of, even though we have roughly 30,000 employees, the number of devices now in the medical world far exceeds the number of people that are touching
Yeah, because
them.
we're talking about medical machines, and they're also connected nowadays, obviously. And
Everything's
Yeah.
connected, right? And it's
The patients connected as well?
yeah,
Or the
absolutely.
devices of the patient?
the
Yeah.
patients themselves,
Yeah.
well,
Yeah, yeah.
hopefully not. But
Yeah. Well, yeah, and the idea that all of these devices produce data, right? And as we get into the age of AI in medicine, when you have a disconnected device or a disconnected set of data, it's not available to AI to go do really interesting, really transformative things with. So we think the devices and the data that they generate is just continues to explode, because the more you can put sensors in, the more you can have a device that's feeding some amount of data that doesn't necessarily now require a human to look at, but an AI agent or an AI process that can look at that data and make transformative clinical,
but just to finish the initial thing, your entire network is HPE Aruba Networking.
we're just about done with the migration. So we've been on the Wi-Fi now since 2020. We made the choice to go CX switching in 2022. We've got about 90% of the network converted over to CX switching. Data centers are now all running on the Aruba 10K platforms and a fine leaf architecture. We've got a pilot of Edge Connect, so we'll be getting off of traditional hub and spoke WAN and over to SD-WAN as one of our next projects. We're rolling out the Access platform for SASE, and getting over to micro branch for our telecommuters. So we have about 4,000 staff that work full-time remote.
So all your locations are connected to each other.
And what was the reason to go for HPE Aruba Networking, apart from
Sure.
maybe a very sweet offer?
It started back in 2019, where our legacy Wi-Fi vendor was struggling in our environment. We had a lot of issues with connectivity. At the time, we had about 9,000 wireless devices in the environment. Today, we're over 30,000.
Yeah.
We couldn't get the network to perform the way we needed to in a reliable way. We were starting to roll out Wi-Fi handsets to all the nurses. We had about 7,000 handsets to roll out, and the Wi-Fi network just couldn't handle it. So we looked at all the alternatives. We chose HPE Aruba at the time.
Was that AC when you'd moved, or was it still N when you?
It was AC.
AC,
Yeah.
okay.
Yeah, and
But you had to do a fast migration then if you gave out the handset and it
Well,
wasn't working because you are in healthcare, so things that don't work is not a very optimal.
unfortunately, we had to pause the handset rollout because the experience was so bad
Okay.
that it just wasn't safe to continue to roll them out on an unstable network. Now, remember I said 2019 into early 2020. We all know what happened in early 2020.
Yeah.
We literally had deployed a new patient tower in one of our hospitals with Aruba Wi-Fi. As we were getting ready to turn that tower up for clinical use, COVID hit. And the CEO of the hospital asked, could we open the tower 4 months early?
Yeah.
And we said, sure, but we don't want to run old Wi-Fi in half the buildings and new Wi-Fi in the new tower. So we need to complete the migration. And we cut over the entire hospital, that entire hospital, in about a day and a half over to Aruba Wi-Fi. And the story that my lead network engineer always tells is, and then our phones stopped ringing.
Yeah.
Not because they were broken, but because the problems went away. So we literally did a 1-for-1 replacement with the legacy APs to the Aruba APs, and they just
And you only replaced the APs, or also on the cabling and all that stuff?
no. At that point, we were just replacing APs, and because we weren't seeing issues, in the physical infrastructure side, it was all roaming events, it was all association events, it was just the legacy Wi-Fi was not performing well.
So how does that go? You have a team of guys with a ladder taking down and putting it up, and another one is F5ing to see if it gets
literally
checked out.
watching the APs pop up and watch the clients fail over.
Yeah.
And again, the trouble ticket stopped at that hospital. So even though we were starting to face COVID, we continued with the Aruba migration because we knew all these COVID use cases of telemedicine and iPads and things that were going to come into our environment very, very rapidly. It would be so much easier with a good Wi-Fi.
And you didn't move the problem back to your data center, or where all the data comes together and needs to be handled, or
those were in good shape. And again, we were starting to use some cloud services, so things like Zoom, as a way to connect patients with caregivers, so you didn't have to walk in a room. But if the iPad couldn't connect, it was, nurse had to put on PPE and go in the room and have a 2-minute conversation.
But that still doesn't really explain why you went for Aruba, right? So, or HPE Aruba Networking, we should say nowadays, but because there are other vendors that maybe would also have been able to. Because but in 2019 you went for that was still AC times, right? That wasn't 6 yet.
No, it was not 6. That was the.
So you're still at AC now, or Wi-Fi 5 now?
Yeah, we're still on the 500 series APs. We're starting to think about the 7 series jump. Because we've gotten our good 5 years out of the Aruba APs that we have, and we need to go. But kind of back to how did we get there? We did a pilot with HPE Aruba in late 2019 at one of our health plexes, just to kind of see it really work in the field. Had a really good experience. Did all the cost modeling, so the business case side of it. So we said, okay, we validated the technology in a clinical setting. It works for us. Let's do the cost models. Let's see what this is going to look like for a 5-year TCO on a full migration. Made perfect sense that way. And what really sealed the deal for us was the people from Aruba. That, again, we're standing there on the cusp of COVID, and I've got Aruba folks in my hospital throwing on masks and going and helping change out APs. Like they were deeply invested in our success. And that was 6 years ago. And to this day, every week I have an Aruba person on site with my team helping us with whatever forward looking thing we're trying to work on, or if we're having an issue or a struggle, they're there by our sides. They're truly, I give them hospital badges so they can come and work on our sites and be part of our team. And that's how we've grown the relationship from just the Wi-Fi to all the other parts of the stack, is that it's the people supporting that technology.
Yeah. And what were your initial experiences with Aruba Central, for example? Because HPE Aruba wasn't very quick with migrating Aruba Central to GreenLake and to the cloud, or something, because they were a long time. They were on-prem controllers still.
Yep.
How did that work out for you?
Yeah, our original Wi-Fi deployment didn't really have Central in it at all. It was Airwave and Mobility Conductor and all those pieces that were on-prem appliances. And then as Central matured a little bit and we started considering the CX switches, we knew it was time to bring Central into the mix. And our Aruba team at that point had really laid out the roadmap for Central. And we understood not necessarily where it was, but where it was going, right? And as we made the decision to go CX switching in 2022, that's when we really bought into Central. And so all of our switch deployments have been cloud managed from day one. And we're in the process right now of getting over to AOS 10, moving the APs from the traditional management model on-prem into the cloud management. So that's one of our big pushes here for the rest of the year. Is to
What did you make of the big refresh of Central, with especially with a very nice, neat topology thing in there?
I love Next Gen Central. We've been in the beta for a while, so I've had a slider on my Central for a very long time, and 90% of the time that I go into Central, I'm jumping over to New Central, and much easier to navigate, very clear interface. So when I'm looking for something, I can find it much easier. We're now getting excited about the integrations with OpsRamp and the things that are coming down that path to get better visibility into the pieces of our network. Like, we're a big Palo Alto shop, so we want to see things like our Palo footprint in OpsRamp inside of Central. And then, watching the demo this morning of the AI agent capability, and I'm looking at my NetOps team that's always stressed out, and my device teams that are always struggling with understanding events. The idea that can be working in the background, highlighting problems for us, doesn't necessarily have to solve them, right? One of the things David Hughes mentioned today was, because think of the AI agents like interns. Okay, we've had network interns in that we give little things to, and they come and they have their little report of what they found, and the AI agent can do that.
So let's hope they're good interns, because
but it doesn't mean we're going to get. What doesn't mean we're just going to let them loose and let them start configuring the network, right? But when an intern comes to you and says, "Hey, I noticed this, and I did this research, and here's the problem, and here's 2 suggestions on how to fix it," that is value.
Yeah, because most problems stem from config mistakes or whatever it is, right?
It absolutely, again, with the size complexity of the network, configuration can be hard. Some of it's situational. So when you're dealing with things like interference on channels, and in a medical office building, we may see 30 different SSIDs, right? So helping us sort that out. We have medical devices that embed Wi-Fi into what they do. So there's definitely always external sources to the problems too. And then just things like hardware failures, or somebody's plugged something into the environment that's generating BPDUs, and you're not expecting them, and you want to react to that. So there's lots of things that happen in our environment that.
And what do you make of the push, especially this week, especially when it comes to agentic, with all the agents around on compute, network, storage, and all that stuff? Because you're mainly an HPE Aruba shop now, right? So the rest of HPE is not, you're not really too deep into that.
Correct.
But if you hear that, does that get the juices flowing in terms of, we need more HPE in other sides of the company as well, or?
It does, and I think, again, it marries with the positive experience that we've had with HPE Aruba. So it does open the doors to lots of other conversations around GreenLake, around HPE storage and compute, and those needs that we're going to have as AI continues to change.
You don't have any fundamental objections to being locked in, for want of a better word, into one ecosystem?
Well, lock-in is I wish I could get everything I need from one vendor some days, right? That there's always going to be variety in our environment. Our medical partners are going to drive parts of our architecture. Again, I have servers in my data center that, they're medical devices, they're FDA regulated. I'm not touching them, right? So we'll see everything under the sun.
Yeah.
You know, first it always comes back to the network, right? I've got to manage the network well, and I've got to be able to support all these various things that come in. And then when I do need to bolt on my own servers and storage and those pieces of the environment, I do want it to be simple. I don't want to feel locked in.
Yeah.
But the easier HPE makes it for me and the more cost effective they make it for me,
That's true.
the more I'm incented to go down their path.
Yeah. And just to wrap up, how much did it bring you, right? So the choice you made in 2019, could you put and then so in 2019 the APs, 2022 the CX, and then going all
Data
in on the
center and
data center.
SD-WAN, yeah.
Did you do any calculations, or maybe you have a rough estimate of how much did it save you in time, or
Yeah.
in that kind
Yeah,
of stuff?
I wish I had time to do that. HPE offers to do that for me. It's great. And
Yeah.
there were some points where like TCO calculations against some of the competition for things like access campus switching, we were seeing 30+% savings over 5 years. So there's definitely some numbers behind it. Well, my CFO's office may ask me for those things from time to time. What's more important to us is reliability, because you got to remember, on the end of every one of those switch ports or every AP association is a patient, right?
Yeah, but also an employee, right? And
an employee,
and they need to they need to perform, or they need to work more efficiently, or they can work more efficiently if the infrastructure is better.
Absolutely. One of the conversations we've had this week is private 5G, because one of my biggest challenges is keeping doctors connected in the hospital. And yeah, Wi-Fi is part of that answer, but there's sometimes Wi-Fi is not the right answer. So the idea that we start thinking about private 5G, because it's matured to the point from our perspective that we could deploy it from Aruba without a lot of headache, versus the traditional DAS systems that we use today, but give our physicians, for example, private SIMs on our private 5G and let them have a 5G experience in the hospital rather than a Wi-Fi experience. Again, not that one's better or worse, but just, another capability, so that if a doctor misses a text message or misses a secure chat message in Epic, that's delayed care, or it's a problem that we have. So that's a really important population.
So there are still lots of areas to branch out to.
We're never done, right? And again, like keeping up with the capacity and the growth, that 125,000 nodes is only going to keep growing, not just from the hospital builds, but just from the devices we put in the rooms. But then, each group that we support that's involved in patient care. I was just on the phone about our rollout for our EVS, our janitorial team that cleans the rooms and does all those kind of things, because we want to move them to real-time workflows, right? Where they get notified and they can go, turn a room around, and we can put another patient in that room sooner, so that we get somebody who's boarding in the ED out, or, get somebody moved to the right unit. Those workflows change people's experience in the hospitals.
Yeah, Jake, thank you for your insights on a giant Aruba infrastructure. Maybe some viewers can think, oh, we have a bit of a smaller environment, so it could work for us maybe as well.
That's fine. Yeah, to each their own. I'm sure that everybody's got their networking challenges, but everything depends. We always say it always depends on the network. You can build the best medical record system, you can have the best healthcare team in the world. If their network is struggling, it's not going to be a good day. Yeah. So that's why we love our Aruba network, and we're going to keep building on it.
Everything. Thank you all for watching. This was HPE Discover for us, and see you next time.
Thank you for watching TechScene TV, the channel about enterprise technology that brings you IT insights and analyses from events all around the globe. We cover everything, everywhere. Visit techscene.eu for more written in-depth articles and analysis, or keep watching techscene.tv. Don't forget to subscribe to our channels and share your favorite videos with your colleagues. We'll see you soon.